Hello everyone, and welcome to this aptitude test preparation session. Today we are going to look at the assessment and observation process for your aptitude exam. This is an important nursing assessment because you are expected to demonstrate much more than simply taking vital signs. You need to show that you can communicate professionally, assess the patient systematically, collect accurate observations, recognize important findings, and document them correctly. The easiest way to approach this assessment is to follow a consistent sequence every time. So let's go through it step by step. Before you begin, first check scene safety. Then maintain the patient's privacy and dignity, perform hand hygiene, and introduce yourself. For example, good morning, my name is Jenny. I am the nurse looking after you today. Then confirm the patient's identity using their name and date of birth, and check the identification band or documentation as required. Next, ask about allergies and, importantly, ask what reaction the patient experiences. Then, explain what you are going to do and obtain consent. You should also assess whether the patient has any pain or discomfort. You can say, "Are you comfortable? Do you have any pain? Could you please score your pain from 0 to 10? Finally, make sure the patient is comfortable and that the call bell is accessible. These opening steps are important because they demonstrate the nursing values of care, compassion, competence, communication, courage, and commitment, often remembered as the 6 C's. You demonstrate these values through your actions, maintaining safety and dignity, communicating clearly, showing empathy, performing a systematic assessment, escalating abnormal findings, and documenting your care. Start with the patient, not simply with the observation machine. Look at the patient. Ask yourself, does the patient look comfortable? Are they in distress? Are they confused? Do they look pale? Are they sweating? Are they experiencing pain? This immediate general assessment gives you important information before you even begin taking the observations. Then move systematically through A to E. A. Airway. First, assess the airway. Ask the patient something simple, such as, "Can you tell me how you are feeling?" If the patient can speak clearly, this provides useful information that the airway is currently patent. Look for any obvious obstruction. Next is breathing. Assess the respiratory rate, rhythm, and depth. Check the patient's oxygen saturation and whether they are receiving oxygen. Look at their chest movement and work of breathing. Be alert for respiratory distress, accessory muscle use, sweating, cyanosis, or abnormal breathing. Also, listen for respiratory noises such as wheeze, stridor, or cough, and consider whether air entry is equal. While you are assessing, verbalize your findings. For example, respiratory rate, rhythm, and depth are being assessed, and I am checking oxygen saturation and signs of respiratory distress. Now move to circulation. Assess the pulse or heart rate, including its rate, rhythm, and strength. Measure the blood pressure. Check capillary refill, pallor, and peripheral perfusion. Also look for signs of bleeding or shock. Remember, you are not just collecting numbers. You are looking at the patient's overall circulatory condition. Next is disability. Assess the patient's level of consciousness using ACVPU, alert, confusion, voice, pain, and unresponsive. Assess pain and consider urine output. Blood glucose should be checked if indicated. If a neurological assessment is required, you may also be asked to use the Glasgow Coma Scale, or GCS. Finally, move to exposure. Measure the patient's temperature. Assess appropriately for bleeding, rashes, injuries, or bruising, and consider relevant medical history. Remember, exposure must always be performed while maintaining privacy and dignity. Once your assessment is complete, record your observations on the chart. The key observations include respiratory rate, oxygen saturation, pulse rate, blood pressure, and temperature, together with the appropriate assessment of consciousness. Depending on the scenario, you may be given an in-use observation chart, GCS, or another basic observation chart. Make sure you record the information accurately, do not leave unnecessary blanks, and calculate the score accurately. So, remember the basic sequence: safety, hand hygiene, introduction, identification, allergy, pain, consent, general assessment, A to E, observations, and recording. In the second video, we will continue with in-use calculation and interpretation, recognizing deterioration, escalation, holistic assessment, the role play scenario, documentation, and how to safely close the assessment. I'll see you in the next video.